Hello everyone, my name is Father Jose Nieto. I am a member of the community of St. Paul and a priest of the Archdiocese of Milwaukee. On behalf of my community, I would like to express our gratitude to the pastor of this parish, to all of you, and to the mission office of this diocese for giving us the opportunity to talk to you about the missionary work that our community does in other places. We thank you in advance for your generosity, and we ask you to pray for us as we also pray for all of you. Thank you. The Community of St. Paul, CSP, is a public association of the faithful in the Catholic Church, made up of priests and lay men and women from various countries. Our headquarters is in the Archdiocese of Milwaukee in Wisconsin, and we are present in Bolivia, Colombia, Mexico, the Dominican Republic, and Ethiopia. The CSP carries out programs in health, nutrition, education, agriculture, and attention for children in need, as well as pastoral work. Crucial to our missionary work is the appeals we make every year. Through them, we not only seek to sustain our missions, but to spread the news about the work our church is doing in remote places. For several years, the CSP has been given the opportunity to participate in the Sunday Missionary Cooperation Program in some dioceses of the United States. Through the generosity of many people from the different parishes, we have been blessed and allowed to continue our mission in the places where local churches cannot provide for the needs of the most vulnerable. This year, 2020, has brought not only the usual challenges to finding the financial support to run our missions, but also the added challenges of helping the vulnerable during and after the current pandemic. Since the beginning of the public declaration of the COVID-19 pandemic, we have been bombarded with so much news about the magnitude and negative impact of the new virus. Whether we agree or not with the measurements taken by local governments, one thing we know to be true: the current situation has affected us all, and even more so those who already were afflicted by the preventable stigma of poverty. After much consideration and prayer, we have decided to ask for your support to care for the children and elderly we serve in the Dominican Republic. The Community of St. Paul in the Dominican Republic is based in the parish La Sagrada Familia of Sabanayegua in the province of Azua. For more than 17 years, the parish has been cared for by priests of the CSP and other members, carrying out the pastoral and social work for the people present there. Currently, we are serving a population of 30,000 people amongst 22 communities. Besides the sacramental work, we also have social programs. We have 3 early childhood centers that offer daily preschool education and a nutritional supplement to 160 children from 2 to 5 years old. The children are monitored by a nutritionist who is a member of the CSP, and the staff of this program includes 7 educators and 5 cooks, and a doctor that conducts regular wellness checks on the children. In 2019, various structural improvements were made to the centers, and an emphasis was placed on encouraging parental accountability in the care, hygiene, and nutrition for the little ones. Most of the staff is paid through the constant help of benefactors, but for the food and school supplies, we depend on the generosity of local businesses, which now are also affected by the pandemic. On average, every month, the center spends $1,600 for 2 meals offered at the centers and for the school supplies for 160 children. That would be a total of $19,200 a year. There is also a special program called the San Jose Group, through which 100 elderly people are helped by having access to monthly food pantries, basic medical attention, and special meals on holidays. The elderly is being taken care of periodically by a group of parishioners at La Sagrada Familia. They oftentimes live alone and need health assistance, house care, food, prayers, and company. The goal of San Jose Group is to give them food, medication, and any kind of assistance. But at the same time, we want to give a comprehensive care, interacting with their families, learning about their situations, and tailoring the best response for each one of them. We aim at preserving their dignity, promoting their responsibility and that of their families, and to create the necessary conditions to ensure as much as possible their physical well-being and emotional stability. The amount and the extent of the needs of each person varies greatly on each situation. On average, each person would need $10 a month. That means $1,000 a month for all the seniors registered and $12,000 to keep the project going for 1 year. The assistance, depending on each specific case, could include food, medicines, transport, regular visits to the hospital, house care, and clothing. Since the beginning of the COVID-19 crisis, every 2 weeks, food supplies have been provided for the 100 elderly in the San Jose Group. This is twice as often as usual, with twice the amount of food, meaning we're currently offering 4 times the usual amount of aid. In addition, food is also provided to the families of the 160 children that attend our 3 nutritional centers for early childhood. The quarantine restrictions in Savannah Yegua have made it difficult for many families to continue their jobs and thus receive their daily income, with which they sustain their families. Many people work as informal day laborers, meaning they were already living day to day before the crisis. While the people of the Dominican Republic in La Sagrada Familia Parish face a similar challenge to us living in the United States, the day-to-day reality before the crisis caused by the pandemic was already precarious. No more than ever, they need our support. There is a beauty in that as a church, as we face similar changes and challenges like never before, we're able to foment hope for our brothers and sisters in La Sagrada Familia, and indeed for the whole world. We thank you in advance for your financial support, and we kindly ask you to keep us in prayer as we do the same for you. Thank you.